All right, we have now the voice of you, right? The voice of the community. I've talked a lot about symplr's point of view on healthcare operations, but now we have this esteemed panel of leaders from very different functional aspects within very different systems. And maybe Dr. Chaudhry, we could start with you and we'll work to the left. You would just do a quick introduction.
Good morning, everyone. Zafar Chowdhury. I'm the Chief Digital AI and Information Officer at Seattle Children's. Seattle Children's, obviously, pediatric health system. We're in the Pacific Northwest, 46 sites across Washington, Alaska, Montana, and Idaho.
Great. Michelle James, I'm the Chief Clinical Officer, Risk, Patient Safety, Quality, as well as Chief Nursing Officer for Peace Health. We are in Washington, Alaska, and Oregon.
Amy Olson with Advocate Health. I'm on the IT side, and I'm responsible for all of our corporate workforce and ERP solutions. Our system is third largest in the country, I think, right now, which is kind of mind-boggling. But Wisconsin, Illinois, Georgia, and North Carolina.
I like how you added right now to that, too. It's not foreshadowing anything, Amy. Phil.
Hey, good morning. My name is Phil Hampton. I'm the Chief Supply Chain Officer for Presbyterian Healthcare Services in New Mexico. Presbyterian is the largest healthcare provider in the state of New Mexico, so we're the largest healthcare system. We have the most hospitals, most providers, and largest health plan.
Awesome. Well, thank you all so much for being here and spending a few minutes with us. So, Dr. Chaudhry, let's start with you. You are well known in the community for being passionate about the relationship between IT and the clinical side of the house, both in the educational programs that Seattle Children's supports, as well as the way you work directly with nursing to understand the impact of IT. How would you describe the necessary mandates to the industry to continuously improve how IT empowers clinicians to do their work? And second part, because it's got to be a two-part question, how do you balance this with software decisions considering new innovation like AI, cybersecurity, all in the reality of limited budgets?
So I don't think it really is about technology. I think it's about what you said earlier. What problem in healthcare are we trying to solve? And as you navigate your health system, I do like to go out and chat with people because people are people. And you won't ever replace them with a bot or an AI. And when you talk to people on the floor, whether it's in supply chain, whether it's in payroll, whether it's in nursing, clinical, they all have a story to tell. And if you're really trying to drive a change in your organization, it won't be because you bought the next sexy platform. Let's be truthful. It's going to be because you've understood what problem they have, and also you are going to provide protected time for those individuals to adopt the change, which is the biggest mistake we make in healthcare. We're very good at coming to conferences and seeing the next shiny toy and then going back and saying, well, we should implement this immediately. And to your point earlier about AI companies lobbying your CEO and CFO, that happens to us all the time in our health system, right? I get told immediately, how can we reduce 300 FTEs? And I'm like, well, probably never, right? Because these technologies aren't going to solve for that. So I think you've got to take time to understand what's happening in your particular health system, and everybody's slightly different. And then you've got to get people surrounding you. As a technologist, I like to surround myself with people that are a lot smarter than me in the function that they actually do. And I also like to pay them for their time so they can absolutely support the change that you're trying to bring in the health system and at the pace. And the other point I would make is sometimes you shouldn't replace the software that you have with a platform because it costs more to replace it in terms of change than it does to actually have a real impact in your health system. So you have to measure all of those things before you actually move forwards.
But it's really the intentionality. It's having a plan, understanding where you want to be, and then executing over many years with the right people against that plan.
Yeah, I like to say these programs are really an invest to save. When you're talking and sitting down with your CFO, well, my CFO always tells me, well, you spent this money, can I start make savings on Monday? I'm like, no. You invested money today, it's going to be 3, 4, 5 years. I might not be here, but 3, 4, 5 years later, you might see a benefit to what we've actually done.
And I'd love to know, because I'm sure many of the folks in this room would love to know, What is that dance like? How often does the CFO say, okay, great, we'll look at that over a 5-year horizon, and how often do they say, I'm sorry, it's just not going to work, I need ROI tomorrow?
Well, I think they all say they want ROI tomorrow. Or yesterday. And that's because 3, 4, 5 years from that point, they won't even be there. Look at the turnover rate for C-level executives in any health systems, probably about 2 years. So I think that's a challenge you have to overcome. But if you, as a technologist, have the support of the users that you are actually supporting, then any change can actually happen. And it doesn't really matter what the CFO or even the CEO says. What I've found is the power is in the people that are actually doing the frontline work. The power isn't because I have a big title and somebody's going to congratulate me for that title. And you're only as good as the title for the day that you actually sit in that title. I think you've got to go out and get people surrounding you who are going to advocate with you for the greater good of that particular health system.
I was at dinner in the fall with a CIO, and she said that she measures her success not by dollars or time. It's when they talk about IT, they applaud, they don't boo. I thought that was actually a brilliant, she was trying to be funny, that was an actually brilliant way to think about it. Awesome. Thank you, Dr. Chaudhry. Michelle, healthcare is nothing without our caregivers. Yes. It's not healthcare. And there's critical working relationship between HR, clinical leadership, and IT. Michelle, would you please talk for a couple of minutes about how your working relationship with your HR and IT colleagues is, and how software or technology is critical as you think about reducing burnout, training, scheduling, safety, and compliance? Really, how are you to use technology to do all the different things that are in your job description, which is very broad? Yeah. By the way, your card must be very long on your title.
I haven't changed it on the card.
No,
It's just too much.
They just keep adding more.
That's right. Yeah, and that's healthcare today. I think we just have more things added. But to your point, Dr. Chaudhry, we have to make sure that we surround ourselves with really smart people that are doing the work. And I'm a little bit selfish in how I'm thinking about healthcare today, because I'm one of those boomers that, in the next 3 to 5 years, I'll be leaving healthcare, and I want our healthcare system better tomorrow when I need that care than it is today. And I really, right now, we're new partners with symplr. We partnered about 1.5 years ago, and we've just implemented one of the systems, the workforce, timekeeping and scheduling. And when we made that decision, it really was all about our caregivers, because today, our managers, I'll speak for nurse managers, I think it's probably one of the hardest jobs in all of acute care and probably in our clinics as well. They're getting directions from everyone, and there is so much administrative burden that they're dealing with every day that they don't have a lot of joy in their job, and they have burnout. So when we went into this, we really started talking through how do we partner differently with HR so we're not in silos. So I work really closely with my HR partner when we hired on together right about the same time. And I said, I need you to be my best friend in this work. I need us to be aligned because we're heavily unionized and we have lots of different contracts. And when we're making decisions, we need to be partnered so that that we're not working in these silos. And we pulled in our finance partners as well, because we felt like these functions all work so closely together when we're looking at timekeeping and scheduling. And we wanted to make sure that whatever we did, that we wanted to automate, integrate, and ease the way of our caregivers and those frontline managers. And so that's how every communication that we've done with our implementation, which is about 2 months into our implementation. So we're in a stabilization phase right now, and then really looking at how do we continue to optimize. And doing that optimization is really about going out, hearing what the frontline clinicians are saying. What are the things that we need to do differently to ease your way, to give you back that time so that you can do the important things? It's caring for our patients and caring for our caregivers. And when I look at a manager's role, that's their role. And we have put so many other things on them that they're not able to do that well. So those partnerships are just incredibly important. And if we can reduce that, let people work at top of license, we really believe there's going to be more joy in the work that they're doing.
And for those nurse leaders who've been involved in this or any other project where really the intent and the cross-functional alignment is about improving their productivity. How's that been received? What's been the reaction?
Yeah, nobody wants to hear the word productivity. So I'll just put that out there. That's kind of one of those negative words. But efficiency and then really focusing on the right work, that's what we keep hearing our managers say. I want to be able to go and round with my caregivers. I want to know what's happening with quality and safety on my units. And so being able to give them that time back is really important. And so that's what we're continuing to work through with that optimization, because that's where they get their joy in the work they're doing.
Love it. That's what it's all about, right? I know our Daisy friends are here would agree with it as well, right? Mark and Bob? Yeah, exactly. Phil, a critical piece of hospital operations is managing the supply chain. But between inflation, tariffs, and the general economic uncertainty, again, I think this was written 3 weeks ago, it's even worse today, challenges are only mounting on top of an environment where we're still trying to increase margins. In a world of ever-changing fiscal health, let's talk about the implications of IT decisions. Always fun. Specifically, as there are advancements in platforms, other different solutions, there's different risk and reward equation, right, to think about that. Dr. Chaudhry's right. There are times where you shouldn't replace a point product for a platform. There are times where you should. Supply chain, it plays a critical role in this. What's your perspective on supply chain's role in working across all the different functional aspects to make sure that you have both the technology but also the financial health of the system in mind at the same time?
Yeah, great question, right? I feel a little curious sitting up here like, oh man, I probably represent the CFO in this room, and that's probably not a happy place to be. Don't worry, I'm the one the CFO yells at when the expense line doesn't look right. You know, it's interesting, right? So our job is looking at expense management, right? And so we spend our time on medical devices and capital equipment. But the thing that's really jumped to the top of our radar of recent is IT expense. And we've continued to see that expense grow and grow and grow. And as you dig into it a little bit more, and this is one of the themes of this early morning discussion, what's the value we're seeing out of that investment? You know, we're investing in these technologies, whether it's an enhancement in our ERP or an EHR or a point solution that we want to add on because we think it's going to drive value, but are we truly seeing the return on that investment? And people have alluded to the idea of like, well, what's the business problem we're trying to solve versus, hey, this seems cool, I should do it. And so as we've gotten involved in that conversation, you know, we've really been driving towards, well, how can we start to measure the performance and the outcome that we're hoping to generate with this new investment, right? And I think the investment is warranted. And again, we're not going to get it day one or we're not going to get it yesterday, but can we put out a reasonable time horizon of when we do think we'll see that return for that investment? And then did it actually achieve the result we thought it would achieve so that we know in the future, okay, this worked well, let's do more of that, or this didn't work well, let's do something different. Because I think that's part of, you know, again, I hate to be the person sort of representing administration who you're kind of, hey, I have the purse strings. But, you know, they want to know that these investments that they're making are actually seeing outcomes. And I will say, you know, a lot of times as business problems are presented in the organization, and it could be clinical, it can be regulatory, it can be financial in nature, oftentimes the solution is, well, we're going to need more people or more technology or more equipment to solve that problem. And so it's always an investment discussion, and I think there's just a new discussion now around IT and that investment because there's the total cost of ownership for any investment that we take. You know, most people look at, well, what's the price tag for this solution? But they don't appreciate all the things that Amy's team has to go through to both implement that solution and support it long term. And what's that true investment number? And are we resourced appropriately for that? And so as we think about symplr and creating a fourth platform, well, there are some economics around that model that make sense. And so I would tell you I'm rooting for that to work, right? I think that's the right approach for this company, and as I've been involved with this organization now for 3 years, that's what's most excited me. And I'm also critical of them when I don't think they're hitting the mark, right? Because like, well, if you're gonna do this, you kind of have to be best in breed in the things that you do so that it doesn't allow my customers to go out there and say, well, Phil, I know that makes sense from a contracting and cost perspective, but I'm not getting the right solution to run my business.
I think that's incredibly well said. The line one head of supply chain for a very large system in Texas told me a few years ago is, listen, if I'm going to change, it can't be as good, because then it's not worth the change. It has to be better, right? It has to deliver more value in some way, and I think that's an important remark. I will say, too, I'll make you the good guy here. It's not always dollars and cents outcomes, though, right? A lot of times it can be clinical outcomes, patient safety, quality of care outcomes. It could be nurse engagement. But correct me if I'm wrong, what's really important is to bring you and bring supply chain and bring finance along in the journey so they can see the progress and see the ROI and not just sign the contract and see again at the renewal.
Yeah, no, that's correct. I mean, when I say outcomes, it's not a financial outcome. Sometimes we're solving for a regulatory issue, sometimes we're solving for a clinical issue, and any of those need to be measured. Right? Like, it doesn't really matter what the outcome is that we're trying to generate. Do we think it's a true business problem? Do we think that this is going to solve it? And then did we actually solve it? And again, that's ubiquitous. It doesn't have to just be financial in nature. It often is. That's the easiest place to start, but that's not where it should end. We're an outcomes-based business. We should be looking at clinical outcomes. And if you do that right, well, the financials tend to take care of themselves.
Well said. All right, Amy. And now to you. I picked on you from the stage earlier. I shouldn't have done that. But 2025 is the year that digital health leaders have vowed to get their house in order. We hear it all. Certainly heard it at Chime, right? Everybody's going to get their house in order. And then they have to go do it. But there have been large investments in EHR. You're doing a large ERP rollout at the same time. You're doing a lot of other things, RCM platforms. But when it comes to operations, it still has been this highly fragmented and disparate area. You've dedicated your career to bridging the gap between technology and business needs. If you would please share your perspective on the advancement of healthcare operations in terms of potential and what you see if done right. Again, symplr or anyone else. I'll use the category, not just us, but cost, security, data, workflow. What do you think?
Well, as I was sort of thinking about this, I've been in healthcare for a little over 20 years, been in, IT longer than that. And it started with the consolidation around ERP, and then we got to the, everybody moved to the EHR. So, but then we got to the EHR, and then we decided we had to redo the EHR because there was something a little better and shinier. And then we came back on the ERP because the old ERP was aging out. We've just never had that opportunity to get to the rest of these technologies. It's they've always been good enough and not a burning platform. They're not falling down, but they're not getting us where we need to go. And as we think about, they're not falling down. It's not the burning platform, but at the same time, it's that slow bleed. And as we're now looking at this, you think about the nurse manager burnout. You think about the cost of staffing and how do you continue to not even do more, just do what you need to do with the resources that you have. This is where we have to start to optimize. And I think as you look at, whether it be the quality reporting, whether it be the time and attendance, the staffing, all of the products that you're talking about here, this is the time to bring those together, make it easier. You talked earlier today about, just think about how many systems somebody has to log into over the course of a day and figure that they do that 5 times a day. Just all those minutes add up. And as Scott Becker said, it's not that we're looking to add another patient into this thing. It's just to have the room to breathe, to think. That's what really. There may not be a financial ROI on this, but if you're not burning your people out, if you're not turning them over as fast, there's real money there. You may never tie it down to the bottom line, but in 5 years or whatever, you're going to see it. So I think that's, for me, where it's the next frontier. It's the thing that we've always wanted to get to. I can't tell you, so we're going to do staff scheduling. I swear we're going to do it. But we've been saying that for 10 years, but there's always the next thing that gets in front. And again, we redo or we re-implement, and now we're there. So I think it's exciting.
You've all mentioned this concept of change and change management as being a critical part of any initiative, technology or otherwise. We have a couple minutes left. Maybe I'll ask you each to think of, and whoever can offer it first, I won't go down the line. But whether specific to your function or across the healthcare system, what's one tip that you might offer your peer community here in terms of a best practice you've seen leverage for good change management inside of your system?
I'll go first. I'm super passionate about change management. It is a work stream in every project that you have. It cannot be an afterthought, and it starts at project kickoff. Matter of fact, it even starts before that. You have to staff for it, you have to plan for it, you have to resource it, because that, if you don't do that piece right, it doesn't matter. You just spent a lot of money for nothing.
Couldn't agree more. Other thoughts?
I think the bigger question is, are these projects in your health system an IT project, or are they operationally led, IT-enabled project? And certainly in my career, I found that they sort of start off as an operationally led project, and then they morph into an IT drama, right? So I think you have to think about how these programs are led. And what I would say is, one thing we do have to do in healthcare is we have to reimagine it from the ground up. I think what we're constantly doing is trying to put a sticky plaster on something that's kind of working, kind of doesn't work. What if we started with a blank sheet of paper? So we're doing one of those platform layers currently, the ERP platform layer. And of course, I asked the CFO, who's going to lead this project? And she said, oh, it could be me, but it might be you, right? And so I think when we went into each
Which means it will be you.
It will be me, yeah. So when we went into each area, we started with, obviously, payroll, because if you don't pay people correctly, you're out of job. And we looked at HR, and we're currently looking at supply chain. We kind of took the approach of, yes, we want to buy new technology, but actually, let's get in a room for days on end and tell me what is working and what isn't working, and forget about the tools, because let's be truthful, every technology vendor will sell you the dream, and the dream isn't necessarily the dream once you buy the dream, and it just goes on and on. So if you were a supply chain specialist, what would that nirvana look like? And it's been quite an interesting journey to understand what that looks like. And once you've sort of mapped that out, it's a lot easier then to buy the technology and then connect it together versus what we traditionally had done, which is, yeah, this works, throw in some technology, throw in a bit of workflow, pray, hope for the best, and move on. So I think as health systems, we've got to start from scratch, because I'm not seeing the improvements that we want to make at a pace that we need to make them. So sometimes you just have to take a big step back. It's difficult because you're going to have to give people protected time to sit in a room and tell you exactly what's going on and how they'd like to do it. But I think we've got to stop just putting more money after more money and then take a step back.
Well said. Michelle or Phil?
Yeah, I think I agree with you, and I think it's really important that what we've done over time is we've done add-on. We just keep adding on and really taking nothing away. And so it really is being able to step back, hear from those frontline caregivers, those people that are doing the work, they're at the sharp end. What is it that really we need to do differently to help them say, you no longer need to do this, this is where we're going as an organization, and really that engagement, I think, is critical from a change management. And I'll say from a communication perspective in the work that we've done recently, because we are pretty siloed, and our IT actually led a lot of the work. And we're trying really hard to say it needs to be clinically led, IT enabled, and in that partnership, then we really will get to where we need to be. But we are branding our things in that we all are working together in those functions. So it's not just coming from IT. It's really coming from clinical. It's coming from HR. It's coming from operations.
I saw a lot of pens moving, and I think the functionally led, IT-enabled mantra may carry on after this event. Phil, anything from you?
I'll just kind of go back to the core of the question. As we think about change management, and don't under-resource it. Right? When you think about a project and project management, like that should be part of the pro forma. That should be part of the investment so that we can do all the things that they just described. There's a prescriptive way to do that. There's a science behind it. Like, to get the outcome that you want to generate with this new investment in this technology, well, let's make sure that we have people in the room. I don't want you and your CFO thumb wrestling over who should own the project. There's actually a right answer, right? But you need somebody in the room that can call the ball on that to say, here's how this project's going to be most successful. So make sure that that's part of your investment, whether it's internal or you have an external partner. Make sure you're always thinking about that. Because as I've watched health systems that I've participated in have these big audacious projects, they have inevitably failed because we didn't have the project management rigor around it to make it successful.
And of course, as a technology partner, it's music to my ears. The number one killer of all technology projects is rarely us. It's internal alignment or lack of resourcing. Now, obviously, we'll take the blame at the end of the day because the CFO gives it to you, you give it to us, and Bob's your uncle, you go find a new one. But that's the number one killer of technology engagements is lack of alignment. What are we trying to do here? And have we dedicated the people to get us to the outcome? I will tell you a funny anecdote as we wrap. The number one driver, software, we do upgrades. The number one driver of support calls after an upgrade is not anything defect related. It's typically a user population that hasn't been trained on the why and thinks something's changed and thinks it's broken. If we automate away, we've done this with one of our tools, we automated away a workflow. And thousands of nurses called in and said, my system's broken. I didn't check my button. We said, no, you don't have to anymore. And they said, then how did I know it was done? They couldn't believe that it actually happened in the background. So change management, key driver, functionally led, IT enabled, incredible thought leadership from all four of you who are doing great things in your systems. Please, everyone, thank our panelists so much for their participation here.